This talk is entitled Tools in Measuring Program and Learning Outcomes of Medical Students, a Guide in Designing the Tools. This will be part 2 of the Tools in Measuring Program and Learning Outcomes. The subtitle of this talk is Tools in Measuring Knowledge, Skills, and Attitude of Medical Students, a Guide in Designing the Tools. Part 1 was on tools in measuring program and learning outcomes of medical students, a guide in designing a master blueprint. Recommended prior study are assessment and evaluation of medical students, R.O. Hawson TPORs, which stands for Thoughts, Perceptions, Opinions, and Recommendations. Another recommended prior study is tools in measuring program and learning outcomes of medical students, a guide in designing a master blueprint, the part 1. Notes on plans of R.O. Hawson OSIL on medical education and the topic, tools in measuring program and learning outcomes of medical students. Part 1 will be on a guide in designing a master blueprint. Part 2 will be this one, a guide in designing the tools. And then part 3 will be a guide in scoring the tools. The learning objective for this particular topic will be the following. Number 1, describe the 3 general categories of tools to measure students' learning and performance as recommended by Dr. Hawson. Indicate the usage of each of the 3 general categories of measuring tools as to types of learning domain as recommended by R.O. Hawson. Enumerate the steps in designing and developing the tools to measure students' learning and performance. Discuss the utility of blueprint for educational measuring tool design and development. Reproduce the table recommended by R.O. Hawson that shows the general format of a blueprint for educational measuring tools with several learning objectives and outcomes. Make a blueprint for educational measuring tools for a learning session or a course that one is currently handling or has handled. Enumerate at least 3 recommended good practices in designing and developing educational measuring tools in general. Enumerate at least 3 things that should be avoided in designing and developing a test with true or false questions. Enumerate at least 3 things that should be avoided in designing and developing a test with multiple choice questions. Give 3 examples of good, true, false questions. Give 3 examples of good multiple choice questions. Give a sample of a station in an objective structured clinical exam with a rating scale. Give a sample of criteria to grade students in a case presentation and discussions. In the curriculum of a medical school, there shall be tools with performance indicators to measure the degree of accomplishment of the students at all levels, namely program educational objectives, program outcomes, course level learning outcomes, and session level learning objectives. The performance indicators will serve as a basis for assessment and evaluation of student achievement through different points in the curriculum from start to finish. I have recommended this framework for the design and development of tools to measure the global accomplishment of the student learning and performance. On the first column is the elements to measure. Here, there should be analysis of the statements on the program and learning objectives and the outcomes on the first column. And here we identify the domains of learning, namely cognitive, psychomotor, and affective. We also identify the levels of learning in terms of the Bloom's taxonomy. And also we identify the behavioral verbs used in the learning objectives and outcomes. These are the three domains of learning relevant to medical education and medical students. Cognitive domain, which include knowing, knowledge, and mental skills. Psychomotor domain, doing, skills, manual or physical skills. And affective domain, feeling, attitude, growth in feelings, or emotional stress. Under each domain of learning, there are different levels of complexity and specificity. So this is part of the Bloom's taxonomy. There should be, or this taxonomy should serve as a guide in the selection of measuring tools. Behavioral verbs in learning objectives and outcomes. Behavioral verbs describe what the student will be able to do after a learning activity, something that is observable and measurable. Each objective should begin with a verb that describes an observable behavior, such as describe, summarize, demonstrate, compare, plan, score, etc. Thus, behavioral verbs in the learning objectives and outcomes should also serve as a guide in the selection of measuring tools. The specific tool chosen for elements to measure must be appropriate or valid, reliable, and usable or practical. Validity refers to the appropriateness, adequacy, accuracy, and effectiveness of the measuring tools, meaning they measure what they are designed to measure. Reliability refers to the consistency of measuring tools in producing results. Consistent results mean that a student being assessed and evaluated gets the same score or grade no matter how, where, or when they are subjected to the measuring tools. And usability refers to the practicality of the measuring tools. It should be economical in terms of time and money, easily administered and scored, and produce results that can be interpreted and applied by the medical school. So tools to use to measure. In the literature, there is a plethora of tools in measuring students' learning and performance that one can adopt and adapt. Select one or combination of tools which are valid, reliable, and usable for a particular program or learning objective or outcome. So here is a list of the tools in measuring students' learning and performance. This is just a partial list. You have objective versus subjective tests, written tests, oral tests, practical tests, objective structured clinical exam, observation, assessment, project-based assessment, performance log or portfolios, patient management problems test, critical incident technique, questionnaire surveys, virtual test versus in-person test, electronic versus paper pen test, classroom exams versus take-home exams, and there are different types of written or electronic exams like essay exams, short answer exams, true or false exams, multiple choice questions, and matching type questions, and others. So a disclaimer, I will not be able to discuss the different kinds of tools that can be used for measuring students' learning and performance. I will just define some trending tools in medical schools, such as objective structured clinical exam and portfolios. OSCE, or Objective Structured Clinical Exam. An OSCE usually comprises a circuit of short, usually 5 to 15 minutes stations, in which student is examined on a one-to-one basis with one or two examiners. Each station has different examiner. Students rotate through the stations, completing all the stations in their circuit. All students are assessed at the station. The sum of the pass marks of all stations determine the overall pass marks for the OSCE. An OSCE is designed to be a subjective or to be objective, meaning all students are assessed using the same stations with the same marking scheme, structured, in which stations have very specific tasks and involve a clinical examination, which is designed to apply clinical and theoretical knowledge. In an OSCE, clinical skills are tested rather than pure theoretical knowledge. Portfolio. A portfolio is a collection of students' work which gives evidence to show how the students are meeting the specified learning outcomes. It can be a collection of learning activities of the students, at times called performance log or logbook, in which the psychomotor and cognitive learning can be indirectly assessed. It can be a collection of reflection papers of the students in which the affective domain can be indirectly assessed. As mentioned in the literature, there is a plethora of tools in measuring students' learning and performance that one can adapt. To simplify things, I hope, these are my recommendations on categories of tools to measure medical students' learning and performance. One is test. Second is observation or observation technique. Number 3, project or project-based technique. Under each category are many more specific tools. Examples of specific tools under each category: test, you have the written test, oral test, observation or observation technique, practical or performance exams, direct observation, learning portfolios, indirect observation, project or project-based technique, case study, case presentation and discussion, research, project management. I'm now going to give my operational meaning and usage of the recommended tools. So the general meaning of test observation technique and project-based technique is that it refers to a tool, technique, or methods that is intended to measure students' knowledge, ability, and performance administered by a teacher or a faculty with specified goal and time limit. It involves the students answering questions in writing or electronically or written test and or through the spoken communication in person or in virtual mode, oral test, and then the teacher or faculty rating their knowledge. So this is the operational definition of test to differentiate it from observation and project. So for tests, these three words are being used interchangeably or often used interchangeably: tests, examinations, and quizzes. However, quizzes are usually short tests and the informal versions of tests and examinations. Examinations are more formal versions of tests and more comprehensive in scope. The three conventional categories of test exams based on what the students do: you have the written test exams, in which the students answer questions in writing or electronically. Oral test exams, students answer questions through spoken communication in person or in virtual mode. Practical test exams or performance test exams, here the students perform procedures to demonstrate ability and skills in person or in virtual mode. In the RO Hoson test category, test exams will include only written oral test exams. Practical test exams are not part of the test category. Tests will be used primarily for cognitive domain of learning. Now let's go to observation. The operational definition of observation is that it involves the teacher or faculty watching the students perform tasks or react or respond to situations in an authentic or real environment, and then rating their knowledge, attitude, ability, and performance. It may be direct or indirect observation. In the direct observation, there is actual watching either in person or virtual, followed by rating. In the indirect observation, there is analysis of records like performance logbooks and learning reflection portfolios, and reports like anecdotes and critical incidents, followed by rating. In the R.O. Hawson categorization of tools, particularly in the observation category, this will be used primarily for psychomotor and affective domains of learning. Now let's go to project or project-based technique. The operational definition is that it involves the students making hands-on project or task single-handedly or collaboratively with other students, and then the teacher or faculty rating their knowledge, attitude, ability, and performance based on formulated criteria. A project is an undertaking consisting of a set, series, or sequence of tasks that must be completed within a defined timeline to accomplish a specific set of goals to attain a desired outcome. Project or project-based technique. In this category, this will be used primarily in assessing and evaluating holistically or integratively and simultaneously the three domains of learning, namely cognitive, psychomotor, and affective. For the three types of categories of tools, they can be used for formative assessment as well as summative assessment or evaluation. The teacher should just indicate the intent of use. They can be graded or not. The teacher should just indicate it. They can be administered in person or online. They can be administered in paper, pencil, or electronic form. They can be administered synchronously, meaning in class, or asynchronously, out of class. They are administered with a time limit, short time period, such as less than an hour, 1 hour, 2 hours, etc. Long time period, 1 week, 1 semester, 1 trimester, etc. The focus of this talk is on a guide in designing the tools. After deciding on which tool or combination of tools to use, the next step is to design and develop it or them. The general steps include the following: make a blueprint, formulate questions and assignments, review the formulated questions and assignments, administer the tools to the students, continually improve the quality of the tools after evaluation of the outcome of administration. The first step is to make a blueprint. There are different terms used for blueprint. One is test blueprint. This is the most popular and most commonly used. Table of specifications, assessment tool blueprint or roadmap. And the last one is blueprint for educational measuring tool design and development. So R.O. Hawson prefers this term as this will not be limited to tests because it can include observation and project, and also can cover educational objectives, program outcomes, and learning objectives and outcomes. Why a blueprint? A blueprint is a map or specification of assessment items based on educational outcomes, and its primary function is to support the validity of assessment with regard to its content. That's why for content validity, it helps to align assessment items with the intended learning outcomes and student learning experience. Blueprint describes the key elements of an assessment tool, including the content to be covered, the amount of emphasis allocated to its content area, instruction on how to implement, time allotment, etc. So make a blueprint of the questions and assignment using the program and learning objectives and outcome as guide. Make an allotment and prioritization of questions and assignment in consideration of time to be given to the students to complete. Include clear instructions for the students. Blueprint is usually in the form of a table. That's why it's also called table of specifications. Here is the general format of a blueprint for educational measuring tools with several learning outcomes and objectives, as recommended by yours truly. So LO1, LO2 to 5. LO stands for learning objectives and outcomes. First column is time allotment. It could be overall, or there could be some breakdown on the time here. Then weight, meaning the relative importance of the contents, number of questions to be asked for each item, for its learning objectives, type of questions, and then instructions and notes of the tool developer. So this is an example of a blueprint for a written test. So time allotment overall, example 1 hour, relative weight shown here, the least weight up to the highest weight plus 4, the number of questions in its for its learning objectives, type of questions to be asked for its learning objectives, and then a note here will be, should it be an online test or in electronic form, or other types of notes that in the intention of the test tool developer. Example of a blueprint of oral test. Okay. Here, there's a breakdown. One overall is 1 hour. So there's a plan to limit 5 minutes to a question to the learning objective 1, and then or 20 minutes for learning objective 5. Okay. So here it shows the relative weight of its learning objectives, and then the number of questions to be asked for its learning objectives, and the type of questions. Okay. Oral questions, usually examples will be in terms of define, describe, compare, explain, discuss. Okay. A note here would be, have to prepare a checklist or rating scale on the spoken answers by the students to guide the grading by the faculty. Example of a blueprint on observation, specifically on OSCE, Objective Structured Clinical Exam. Okay. So example here would be 75 minutes, and each station, S stands for station. So there are 5 stations here. So 15 minutes for each station, the relative weight for each station, the number of questions to be asked in each station. So the type of questions, what procedures to perform in each station. Again, there's a note here, there's a need to prepare a checklist or rating scale on the skill performance by the students to guide the grading by the faculty. Example, project, specifically oral case presentation and discussion. Okay. Total allotment time would be 60, example. Okay. Relative weight of importance of its learning objectives, and then the number of questions that will be asked. This could be optional, and then the type of questions, because it's an oral case presentation discussions. Oral questions can be asked on top of judging the case presentation and discussion itself. Again, a note here, we'll have to prepare a checklist or rating scale on criteria to use to guide the grading. For a written case presentation, example, time allotment, 2 weeks to complete as assignment, then the relative weight for each of the learning objectives. Okay. Whereas to the number of questions and type of questions, this is not applicable here. Okay. It just have to be noted down, not applicable as this is a case study and this will be analyzed or judged based on criteria derived from the learning objectives and other criteria. An example of a note here will be have to prepare a checklist or rating scale on the criteria to use for guide in the judging. A blueprint example on project attitude to measure the attitude. So example here, time allotment will be 1 semester, 1 year, 4 years to observe the student's attitude. Okay. Relative weight of the various learning objectives in terms of attitude. Okay. Number of questions, since this is a project, this is not applicable here. Okay. And then type of questions, also it's not applicable as the tools to be used will be observational, either direct or indirect. Example of a note here would be have to prepare a checklist or rating scale or on criteria to use to judge grading in the observational tool. After the first step, which is to make a test blueprint, the next step is formulate the questions and assignment. And then the third step is to review the formulated questions and assignment, particularly in terms of clarity and time allotment. Preferably, ask for another faculty's review and feedback. The fourth step is to administer the tools to the students. And the last step is to continually improve the quality of the tools after evaluation of the outcome of administration. Here are some essential pointers and examples in formulating questions and assignment. There must be clear instructions or directions on how tools will be carried out by the teacher and accomplished by the students. Information on the following should be clear: formative and summative evaluation, graded or not, how the grading will be made, what is the passing grade or failing grade if graded, will it be in class or out class, in person or virtual, and time limit. The questions or STEM questions on all the different types of measuring tools used must be clear with no ambiguous words and with good grammar and syntax. There must be no double negatives in the statements and questions. Examples of double negatives in STEM questions: none of the following is true except, none of the following is false except, all of the following are true except, all of the following are false except. In the true or false statement, clinical diagnosis cannot be formulated except with history and physical examinations. So none, and then except, none, except, all, except, all, except, cannot, and except. So these are examples of double negatives. Another pointer for true-false questions is that to make sure that the statements used are explicitly 100% true or 100% false. So this is a point, these are a list of pointers for true or false questions. Be careful with the use of the following: modal verbs such as can, may, should, would, or could. And then absolute verbs, never, always, all, and must. And then don't use statements with double negatives. So examples here: make sure that the statement used are explicitly 100% true or 100% false. Example will be clinical diagnosis is formulated based on history and physical examination. This is a good question because it is explicit, it's 100% true. Diagnosis is oftentimes formulated not based on history and physical examination. It's not good because of the word oftentimes. It's not explicit, thus subject to interpretation and subjectivity. So be careful with the use of the following verbs, modal verbs: can, may, would, should, could. Examples here will be clinical diagnosis can be formulated based on history and PE. This is not a good question because of the word can, not explicit, that's subject to interpretation or to subjectivity. Knowing the inexactness of medicine, students tend to answer true because of the word can. Be careful of the, is another example of the use of modal verbs. Clinical diagnosis should be formulated based on history and physical examination. It's not a good question because of the word should. And then be careful with the use of the following absolute verbs: never, always, all, must. Example will be clinical diagnosis is always formulated based on history and examination. It's not good because of the word always. With the inexactness of medicine, using never, always, all, must in the questions are, strictly speaking, the correct response is usually false. So using absolute verbs are considered giveaway questions. Now, another pointer on the use of true or false questions: do not use double negatives. So example will be clinical diagnosis cannot be formulated except with history and physical examination. It's not good because of the double negatives cannot and except. Students will spend more time deciphering what is the real meaning of the questions and will get confused. For multiple choice questions, we start first with the parts. Okay, so the parts of the MCQ will be STEM questions, and then the options or responses with one correct or best answer, and the rest are distractors. Example, this is the question STEM, okay, or STEM questions, and then these are the options or alternatives responses. So A to D are options or alternative responses with one correct answer and 3 distractors. So here are some pointers on multiple choice questions. Instruct the students to select the best answer rather than correct answer. Medicine is an inexact science. The distractors may have an element of truth. This will discourage arguments from students who may argue that their answer is correct. Another pointer will be make sure that the statement in the STEM questions are clear and complete. The statements can be incomplete questions or partial sentence. Complete questions are preferred. There should be one subject or topic per question. The STEM questions must contain as much of the problem as possible. The STEM questions must not contain double negatives. Again, these are the examples of double negatives as has been discussed earlier. Options should not overlap, should be mutually exclusive. The alternative or response options must be similar in form, length, and grammatical construction. Long options tend to be the correct answer. The distractors in the response options must be plausible to avoid giveaway answers. The questions must be stated with no wording or structure that gives clue to the answer. The response options should not contain all of the above or none of the above options, as these statements make it easier to get the answer. All of the above means that the student just need to identify two of the correct choices to get the answer right. None of the above doesn't mean that the student knows the correct answer, just that they can recognize wrong answers. In preparation of the graduates in taking the Philippine Physician Licensure Examination, or PLE, the suggestion is to use 4 options, the multiple choice questions, as this is the format of the MCQ in the PLE. For essay and oral test questions, project assignments, and observation techniques, the pointers will be, there must be clear instructions or directions on how the tools will be carried out by the teacher and accomplished by the students. The question on all the different types of measuring tools used must be clear, with no ambiguous words, and with good grammar and syntax. There must be a formulation of checklists and, if needed, rating scales on the parameters and criteria to be used to grade the answers. To grade the observed behavior and skills and the project outputs of the students. The students must be made aware of the parameters and criteria that the teacher will use in assessment and evaluation. Some pointers on objective structured examination, clinical exam. For example, here will be station splinting a fracture, the title of the station. There is a scenario given. A 35-year-old Filipino male got hit by a car. After examining him, you suspect fracture in the middle third of the left leg. You're going to transport him to a hospital. You are to splint the suspected fracture before transporting him. Instructions are order for materials you need for the procedure and then perform the splinting procedure. Note that you are given 15 minutes to complete the assignment. Stop what you are doing at the sound of a ringing of a bell. So the activities that will be occurring within the 15 minutes are the following. The student reads the instructions, accomplishes the assignment in 15 minutes, the examiner fills up the checklist and rating scale. Examiner can give the feedback to the students. It gives remedial only if there's enough time, and examiner prepares for the next student examining. Then in the OSCE, one has to prepare the resources. Okay, so the examiner simultaneously can act as the pharmacist, giving out materials ordered by the students and as patients, and then woods or newspapers will be needed for the OSCE, cords and checklists and rating scales. As to the evaluation, you have the name of the students, and then here is the rating scale, yes, and pass or needs improvement, no, remarks. Okay. Then materials needed, splinting materials, typing materials, whether they are properly ordered, splinting, okay, whether the students, okay, how the students ready materials for immediate use, and how the students make the splinting, whether it is gentle and in the correct way. Then feedback, whether it was given or not by the examiner, and then the score, the rating by the examiner. No need for remedial, pass, okay, still needs improvement or fail. Okay. Then signature of the examiner and the date. Case presentation and discussions. So these are the learning objectives for the case presentation discussion. Given the patient, mentees provide details, clinical data for clearly and concisely and relevantly, provide good history and present complete physical examination as one would proceed in the bedside preceptorial, okay, relevantly, give differential diagnosis and explain on how the group arrived at the primary working impression efficiently, explain the pathophysiology of disease at hand, and may include theoretical data and possible existing epidemiology with emphasis on the relevancy of all the presentation, provide options for additional diagnostic maneuvers or studies, and provide a surgical plan or medical plans or other treatment options. So this is the criteria formulated for the case presentation and discussion, history and PE, and then with some explanation with 5 points, primary working impression and differentials 5 points, and then plan of management in terms of diagnostic and preparations 15 points, plan of management in terms of therapeutics and surgery 15 points, and then post-op complications in terms of prognosis and surveillance 5 points. So here I have presented the various learning objectives of this session. I have presented the following: 3 general categories of tools to measure the students' learning and performance as recommended by R.O. Hawson. Usage of each of the 3 general categories of measuring tools. Okay. Steps in designing and developing the tools to measure students' learning expectations and performance. Okay. Discuss the utility of the blueprint. Reproduce the table recommended by R.O. Hawson that shows the general format of a blueprint. Okay. Enumerate at least 3 recommended good practice in designing and developing educational measuring tools in general. Enumerate at least 3 things that should be avoided in designing and developing a test with true or false questions, and 3 things that should be avoided in designing and developing a test with multiple choice questions. So, and these are the other learning objectives, but this will be done as an assignment. So assignment here will be for enhancement of self-learning. Give 3 samples of good true false questions, 3 examples of good multiple choice questions, give a sample of station in an objective structured clinical examination with checklist and rating scale, give a sample of criteria to grade students in a case presentation and discussion, and then make a blueprint for educational measuring tools for a learning sessions or a course that one is currently handling or has handled. So one may use the R.O. Hawson template or other template. So for development of the medical school, aside from enhancement of self-learning by the faculty, so compile all the blueprints and educational measuring tools done by the current faculty and archive them for the school. So this will be part of the quality management system of the medical school. With that, I end my talk on this topic, tools in measuring program and learning outcomes of medical students, a guide in designing the tools, part 2. Thank you for your kind attention.